Good evening, people. We would be starting the session in 5 minutes. So, as soon as the resource person joins us in. Thank you. Good evening, everyone, once again. On behalf of Abundant Life, I, Sanjana Padmashri, welcome you all to this third webinar in Careers in Psychology. So, we have had like really interesting topics on these careers in psychology. Like, we know what counseling psychology is now. What is the difference in, what are the different types of counseling, and what are the different types in difference between clinical and counseling. So, all these things we know now. So, now we have the third webinar, which is about clinical psychology. And for giving us a really insightful webinar on this, we have with us Mr. Vigrant Babu, who is an RCI licensed clinical psychologist, and he's also an assistant professor in the Christu Jayanti College, Bangalore. We welcome you, sir.
Thank you so much. Thank you. So, can we start, or we are waiting for any more?
Sure, sir. So we can start now. People can join in as soon as they are
Sure.
in.
Okay. Thank you so much, dear. So, hello all. Good evening. So, I'm sure you all are, as she was telling, you all have already got a perspective about different fields of psychology. And today, when we were discussing, Samuel had asked me, why don't you start talking about clinical psychology? Why don't you make others understand about what is this field of clinical psychology? So that is where our discussion started, and immediately I had agreed, because it has always been a pet topic for me to talk about clinical psychology and how clinical psychology has to be taken up in the days to come, and young psychologists, uh, aspiring clinical psychologists who are sitting here, it is indeed a very um, correct time for you to venture your energy into the field of clinical psychology. So, first of all, uh, when we talk about clinical psychology per se, so many of us have a lot of different assumptions. So, many, like since I'm in the teaching field, I have been seeing in the last few years, there has been a drastic change in the field, and there has been a lot of people who have been asking how to become a clinical psychologist. It has been the hot selling topic everywhere. So many people, they have, or they want to become a clinical psychologist in the near future. And in fact, the road to clinical psychology is a little difficult one, so that I'll be talking about it a little later. So let me start the session today with a PPT. So in this, we'll be trying to understand what is clinical psychology, what is this field, what does it majorly deal with, what are the different activities. Especially in Indian scenario, I'll be trying to give an idea what do we do actually. So that would be the primary agenda that I have in mind. If I'm given the power to share my screen, it would be lovely. Yes. Shruti, if anyone can help me and enable screen share, it would be nice.
Just give me a second, sir. I'm
Yes.
working on it.
Okay. I think you have to go to the security and you have to enable screen share option.
I'm just trying to.
Or easier ways to add me as a co-host. That would make so that I can. Yeah,
That's
yeah. So thank you so much. Okay, so now that the screen sharing is on, So, first of all, what is so we have very few people here. There are many more people who are watching live on YouTube and other social media pages. So, at least people here, if you can, if you want to tell, what do you understand when we hear the term clinical psychology? You can raise your hand or you can put it up in the chat.
So just to give you a heads up, the participants will not be allowed to
Okay.
unmute themselves. So
Yeah.
participants, you're requested to put your comments on the chat box.
Yes,
So
it would be nice. Just your perspective or idea so that I can take it up from there.
okay,
What?
Anupama says application of
Yes,
principles of
principles of
abnormal
abnormal
psychology.
psychology. Okay, thank you, Anupama. Mm,
Anyone else?
yeah. Okay. I think we are taking some time to warm up. So we'll just continue. Probably by the end of the session, we'll take more questions and we'll try to answer more of your directions, perspectives, what has to be done. So yeah, so let's get into orientation to MPhil in clinical psychology. Or basically, I want to talk about everything in clinical psychology. So let's go there. So first of all, we need to understand what is clinical psychology. So yes, Pragati has told dealing with disorders. Thank you, Pragati. Yeah, what is clinical psychology? So uh, psychology as a field has lots of branches. In fact, if you're going to go into the American Psychological Association's website and look into the number of divisions they have, there are n number of divisions. There are lots and lots and lots of divisions that deals with different fields of psychology, in which one branch is called as clinical psychology. So, this field of clinical psychology is, in fact, one of the areas that directly deals with the area of mental health. So, a person who completes clinical psychology, MPhil in clinical psychology, and who's eligible to be practicing as a clinical psychologist is one among the mental health professionals as professed by law, the law that we have in India. So, the core discipline in the area of mental health is what clinical psychology it has. And as I was telling also, and in the last couple of decades, if you see, there has been enormous amount of people who are willing and who are engaging into the field of clinical psychology. So the number of training institutes, the number of students who clear every time, and the number of people who come out into practice has been drastically increasing in the last couple of decades. So from probably around 5 to 6 or 4 to 5 institutes 20 years before, the number of institutes has almost raised to 40 or close to 40 institutes which are recognized by Rehabilitation Council of India. So this becomes one of the most important body when we are going to talk about the field of clinical psychology, because Rehabilitation Council of India licenses the person to practice in the field of clinical psychology. So let's just take a look into the definition of clinical psychology. So this is from the APA's website, and as I told, there are a lot of divisions in clinical psychology. The specific division that deals with clinical psychology is called as a Division 12 in APA. So here, this field or the field of clinical psychology is an integration of science, theory, and practice to understand, predict, and elevate maladjustment, disability, and discomfort, as well as to promote human adaptation, adjustment, and personal development. Clinical psychology focuses on the intellectual, emotional, biological, psychological, social, and behavioral aspects of human functioning across the lifespan in varying culture and in all socioeconomic levels. And standing true to this definition, the field of clinical psychology and the courses that trains you as a clinical psychologist has also been designed in India. So if you see, we can basically understand from this definition itself, we involve into multitudes of work. So we start with basically trying to come up with a scientific understanding of human behavior. We put it into practice or we put it into testing. We theorize it, and once we get a theory out of it, then we start putting it into practice. So using these knowledges that we have understood, predominantly we try to understand what is the problem going on with the person. We try to predict what is going to happen next. So what would be the uh, progress, so like how is the person going to go forward henceforth from this day, from to day 10, what is going to happen. And also we do not stop there, we also go one step ahead and try to elevate any kinds of maladjustments or disability and discomfort that the person is having. By elevating all these things, we automatically promote human adaptation, adjustment, and personal development. So, this is a comprehensive definition which uh, and covers the entire aspect of who a clinical psychologist is and how a clinical psychologist should focus on. So, so when we try to understand a client, we do not take a singular perspective. We have a multitudes of dimensions that we look into. So we start looking at their behavior from the intellectual perspective, emotional perspective, biological, psychological, social, and also the behavioral aspects. So we mix so many different factors, have a very special view on a specific area of a particular individual. Also, we deal with all different stages of lifespan, starting from children to the geriatric problems. Everything is under the field of clinical psychology. So basically, when we start talking about clinical psychology, automatically it creates a lot of fascination for many people. Many of them start feeling that, okay, so clinical psychology, it's very a field which is very close or related to the fields of mental health, can work in a hospital, gives you a good feeling about helping people to come out of their problem. So here one thing that we need to very clearly understand is that the field of clinical psychology is very much focused on the mental illnesses, okay, trying to understand, predict and elevate all different types of mental illnesses as given in international classification of diseases and DSM-5, Diagnostic and Statistical Manual. So these are the various classificatory systems that we predominantly follow in India. So based on this, we try to understand a person, we try to understand what is going to happen next, and we try to help them through therapies and other aspects. So based on this definition, the further uh, session is going to continue. So first of all, this is what we have been telling, a broad branch. It in itself has a lot of things. For example, when we are talking about clinical psychology, as I told, it deals with all all across the lifespan. So there is a specific field called as child clinical psychology. Okay, then we have clinical neuropsychology. So then we have clinical geriatric psychology. So we have specialized fields that has been coming up. So in itself, clinical psychology is a very broad branch because it has a lot of varieties of people to deal with. So here this predominantly focuses on treating mental, emotional, and behavioral disorders. So, starting from as per ICD-10, if you're going to look into, so starting from all the basic problems, disabilities caused by various neurological problems such as Alzheimer's, dementia, moving on to alcohol related disorders, schizophrenia, mood related disorders, affective mood and affective related disorders, anxiety disorders, somatoform, and it keeps growing. So we slowly move into the personality disorders, mental retardation, childhood disorders. So we keep growing into all the different sorts of problems that a person can get across lifespan. So we try to treat these individuals. Also, we play a major role in the identification process as well. So uh, if I just ask you some question, what are the various common mental health disorders that comes into your mind immediately, probably apart from what has been mentioned in this list here? So can you just put it up in the chat? So these are the common ones. Everyone on a day-to-day basis started talking about depression. Depression has been taking up a um, lot of view, or many people have started openly discussing about the episodes of depression that they are having. It's no more stigmatized as it used to be in the previous years. So it has got a lot of uh, different perspective now. So even mental health disorders such as anxiety, eating disorders, substance abuse disorders, learning disability. Also, we also deal with various psychotic disorders like schizophrenia, delusional disorders. We try to help them to cope up with many of their emotional problems that they are going through. We can talk about various personality disorders, clusters of personality disorders that we have, and even intellectual disability, as it has been called now, or attention deficit and hyperactivity disorder, learning disability. So, trying to help a child to cope up with their emotional problems as well as their problems related to the learning, how to cope up, how to try to come up, develop certain skills that would help them to uh, function in a much more better way. So, let's quickly get a look into what does a clinical psychologist actually do. Okay, because now we have a very clear understanding of uh, the field of clinical psychology, the definition, the way it has been defined. So let's just have a look into what are all the various things that a clinical psychologist does. So first and foremost, one of our key areas, if you're going to ask, is diagnosis. So diagnosis, along with that, alongside it, is assessment. So these are the two areas that goes hand in hand and helps us to take our field to the next level. Okay, so when we are saying diagnosis, so initially I told you about various disorders that are there in ICD and DSM. So we try to know the various symptoms that the person is coming up with. There are some specific criteria that has been defined by these classificatory systems. So we get to know about the various classificatory systems, and we try to come up with a diagnosis or understand what does this set of symptoms mean to us, and what could be the potential diagnosis that we can give. So we can basically classify into provisional diagnosis and differential diagnosis. So we try to understand or come up with a bigger picture about a particular client based on the symptoms and symptomatology that has been presented to us during the psychiatric case history sessions. So, along with the diagnosis, one more area that usually many of us clinical psychologists involved in is the area of assessments. So, if you look into assessments, um, assessments are again broadly classified. It has varieties of assessments that a clinical psychologist can get involved into when it comes to mental health related problems. So, first of all, assessments, we need to understand it is nothing but an informed decision. Like, we try to, whenever we are having some kind of diagnostic doubt, okay, or we want to get a much more a better picture about a specific client, we need to look at a person in a much more broader perspective. Then assessments generally help us. So this is a second area that as we as clinical psychologists generally get involved into. So we do a lot of assessments, so starting from uh, intelligence assessment, personality assessments, and various administering various different types of neuropsychological assessments and tools, simple tools, and other things to understand the level. So we can use assessments at various areas and various places. So initially, what we try to do is we try to understand the client in a much more detailed way. So we either can go for any of these things. So first and foremost, that all of us should be trained as a clinical psychologist is in the area of observation. So we all need to know how to observe and what are the problems that the client is bringing in. So there'll be, these are verbal gestures that the person is talking about, but apart from that, there are many other non-verbal gestures that the client would be giving to us. So we need to be very observant. We need to look into what are the different things that the client is telling us and showing us. So we need to understand. Then we need to come up with the idea of what might be the potential problems in this particular individual. Okay, so getting into the next area, so testing. So when along with observation, alongside observation, so usually testing is not done alone. You along with testing, we do a lot of observations. Even during testing, we do a lot of observation, trying to know how the person is trying to answer to a particular question, or what are the things that he's doing when he's going to answer a particular question. So there'll be a lot of observations involved even in testing area. So we get into testing, so we administer test. So as clinical psychologist during your MPhil in clinical psychology program, so you'll be trained in administering different kinds of tools. So as I was telling, so to understand a person's intelligence capacity, we administer various kinds of intelligence tools, starting from Binekamat test, and then Malin's intelligence scale for school children. So, and also we get trained in modern intelligence assessments such as WISC, WAIS. So different kinds of intelligence assessment, Raven's progressive matrices for nonverbal. So we do get in very different varieties of assessments that we get trained into, and we are becoming experts by through the process of uh, case submissions and other things that is part of MPhil. And also alongside this, we also do a lot of personality assessment. So again, personality assessment can be classified into normative personality and the clinical personality. So we generally get involved into a lot of clinical personality assessments, so where we use or we get trained in tools such as Minnesota Multiphasic Personality Inventory, or Millen's Clinical Multi-Axis Inventory, or California Personality Inventory, like that. Very different kinds of tools that we get trained into, and we get used to administering, scoring, and interpreting and writing detailed report about all these different kinds of assessments. So along with apart from this, then we also have a lot of neuropsychological testings that we get trained in. Predominantly, we most of the MPhil training centers trains you in either NIMHANS neuropsychological battery or the AIMS neuropsychological battery. Then we have PGI BBD, PGI battery for brain dysfunction. So like this, various neuropsychological batteries, Indian neuropsychological batteries are available. So we get trained into these areas. We use all these things to understand a client if he's bringing up any problem to the table. So how to understand in a much detailed manner what are the problems that is there. And apart from this, we also do a lot of tools and questionnaires such as Beck's depression inventory, or Hamilton anxiety inventory, state and trait anxiety inventory. So we do a lot of questionnaires, which also can be helpful for us in the therapeutic process. So one, to understand what is the level of that particular problem. So if I want to understand what is the current level of depression that the person is going through, so one, through clinical interview, we understand or we get a clearer picture. Apart from that, we also use these kind of questionnaires and tools to aid our finding. So that is how assessments become very useful for us to get more detail about a particular client. So we get very specific areas that we can focus on in the second stage of getting into psychotherapies. Okay, so apart from observation testing, we also do a lot of detailed interviewing. Okay, sometimes tools and other things also would not be a very useful thing for us, or might not directly answer to the questions that we are seeking for. So sometimes we would have to go for a very detailed interview. We need to sit with the client's guardians and other people. So we try to understand from a different perspective what is actually happening, what are the major things that we are looking into. So we do a detailed interview. So through this, we try to get a detailed understanding about our particular client. So that becomes our major role. So if you want to have a clear cut diagnosis, so like how we use if you're going to an orthopedician, so how he uses an x-ray machine for understanding what is the problem with the bone, or even if you want a deeper perspective, can go ahead and do an CT scan to get a better, clearer picture. Similar way, we utilizes our various psychological assessments and tools that are there to get a better picture about the person's current mental health problem. So this is the initial part of work that we do. So assessments has certain goals. So the first and foremost thing is for diagnosis, to get a diagnostic clarity. So trying to understand what is exactly happening with the client and trying to get that specific diagnostic clarity helps us in treatment planning. As I told you before, looking into the assessment tools that has been administered. For example, there is childhood behavior checklist. So this childhood behavior checklist can give us different dimensions where the child's problem is predominantly coming up. So we can try to take it up, and we can try to develop a treatment plan that specifically works with that particular individual. So we'll get to know what are the shortfalls, what are the strength areas, what are the weakness areas. So we can try to come up or develop a plan, therapeutic plan that would be very useful for the client. So for formulating treatment plan, for predicting the future behavior, so how is the client going to behave in the future, probably our personality assessments, even though the client is not showing any predominant um, characteristic of that particular symptom that we are, particular characteristic that we are looking for, we can predict such behaviors in the future. So okay, so he has the tendency to become stressful, so we need to find out some ways in which we are going to make sure that the person does not have any kind of problems later on. Also, for evaluating the therapy or intervention outcome, so probably we can administer in the end of a particular therapy session to see where or how much the person has progressed across the therapy system. And predominantly in India, we follow what is called as a referral system. So where we do get a lot of referrals from psychiatrists, neurologists, where they ask us, the clinical psychologists, to get a specific assessment done to get a better understanding of that particular client in the hospital areas. So also we get a lot of referrals from the school where they want to get a particular person diagnosed with specific learning disabilities or having any other problems such as ADHD or intellectual disability, if there is any core problem that we need to identify. So this becomes our first and foremost area of work as clinical psychologist. So we involve in diagnosis and assessment. So the next area that we'll be looking into is psychotherapy and intervention. So whatever diagnosis, so as if you remember the definition that we saw about clinical psychology, we just do not stop with understanding. So we go steps ahead. We try to find a solution for the problem that has been brought up to the uh, arena. So we try to understand in a deeper way through assessments. And once we have understood, then we try to see how we can formulate or how we can get a clearer picture about that particular client. And then we formulate a treatment plan. So based on the treatment plan, what is needed, what kind of psychological intervention is required for that particular person, we go ahead and we administer it. So if you look in India, again, to practice psychotherapy or to for a clinical psychologist to practice or venture into psychotherapy, so the RCI has very strictly mandated and regulated and told that a minimum of 400 hours of supervised psychotherapy training must happen during the MPhil training program, which will make a person eligible to practice psychotherapy in India. So only if you complete those many hours, you will be eligible to get the MPhil degree certificate. So automatically, that is where you are getting your eligibility to practice in India as a clinical psychologist as well. So in fact, if there was a recent research that was conducted, which suggests that psychotherapy is one of the most engaged professions in India among all clinical psychologists. So again, another question that predominantly comes up is what sort of training is given, or which is the predominant therapeutic model that is followed. Generally, in most of the training institutes across India, there is no specific training areas or training um, specific method or model that has been emphasized to be trained. But most of the training centers goes for what we today call as an eclectic approach, and we also have a lot of different perspectives about uh, psychotherapy and intervention. So for example, most of the institutes focus on what is called as the cognitive behavioral therapy approaches. Okay, so in cognitive behavioral therapy approaches, we follow the um, next level, that is the third wave of cognitive behavior therapy approaches. So we use a lot of mindfulness techniques and other things also into the cognitive behavior therapy, and we utilize it. So even the training process in the programs these days predominantly focuses on those areas. So apart from that, there are different psychotherapy models that are available in India. For example, there is narrative therapy that is coming up, solution focused brief therapy that is coming up, and also a lot of youngsters like who are attending the session today have a deep interest in in hypnotherapy. So hypnotherapy, or modern branch of hypnotherapy called as cognitive hypnotherapy, even that is getting up um, a lot of site from the young psychologist, and they're getting themselves trained. So there are many other different therapeutical models, specific therapeutical models that we have, such as acceptance and commitment therapy, dialectical behavior therapies, eye movement desensitization and reprocessing therapy. So then we have in India, we other things that we also use is cognitive analytical therapy. So very people get trained in those areas, they try to apply it in our cultural context, try to get a better picture. Okay, so we have a wide array of psychological interventions in our hand. We also get trained in all these wide array of psychological interventions, we get a better picture. So this helps us to apply it in a much more broader manner with our clients. So that is what we try to do in psychotherapy. So, um, uh, to talk more about psychotherapy training in India, so as I told, 400 hours of supervised training is required, and this supervision is something that helps a clinical psychologist to mold their thought processes, to help them conceptualize the case in a much more deeper and a broader manner. So during my MPhil training days, that is what had happened. So our trainees or supervisors, sorry, we as trainees, when we go to the supervisors, they give us different perspective. They try to throw in light from different dimensions, telling us, why don't you look at a particular client from this perspective? Why don't you take a perspective like this that would help you, or try to clear the pathway and go ahead to reaching your psychotherapeutic goal. So that is how a supervised training happens in India. That makes it a much more detailed and broader way in which we handle psychotherapy. So the next area that generally is focused in India is research. Okay, so there are a lot of clinical psychologists who are involved into, or who are predominantly in the academic settings. So not in the clinical settings, but in mostly in the academic settings. And these clinical psychologists have involved into a lot of research activities where they try to consume the available new knowledges, and also try to produce new knowledges, trying to enhance and broaden our perspectives in helping us looking at different clients. So there are a lot of journals and publication outlets for these researchers. So one of the couple of journals that I can immediately remember that publishes a lot of articles from clinical psychologists. One is Indian Journal of Clinical Psychology, which is a journal that comes as a part of Indian Association of Clinical Psychology. Then we have Indian Journal of Psychiatry. That is also a very good journal where there is a lot of focus from a clinical psychology perspective as well. So these are a couple of journals which I can immediately think of. So these are some of the areas where people get their work done, or research done. So the findings of the researchers are published in these kind of journals. That helps us to give a better perspective, gives us a lot of new ideas how the field has progressed, or how the particular problems has to be looked into. So we get different perspectives about all the different areas, such as assessments, diagnosis, and therapy in clinical psychology. So the next field that immediately comes up after research is teaching and clinical supervision. So there are a lot of people who are involved into teaching. Almost 50 percentage of the clinical psychologists, they spend time in teaching others to become a clinical psychologist. So this is very much true even in an Indian scenario. So there are a lot of people who alongside practice also get involved into teaching. So in that teaching, we can immediately classify as traditional and non-traditional teaching. So when we are looking at traditional teaching, it can be again classified as academic teaching in colleges, where we as like such as me. So I'm a clinical psychologist, I'm working in an academic background where I teach papers in clinical psychology, trying to help students understand it from a much more deeper perspective. So similar way, clinical psychologists also get employed and work in hospital related institutes and other places where MPhil training program itself is happening. So these kind of people also acts as clinical supervisors for the particular trainee who are there. So these are the traditional sorts of teaching that is available, and also alongside that we also have non-traditional teaching, that is such as these days the concept of uh, going out teaching to not only to the college, also to spread out, doing workshops, trying to educate, remove the stigma. All these kind of non-traditional ways of teaching of our particular field is also happening very much in India. So there are a lot of people who are predominantly involved into conducting workshops, training programs, and going into the community, working with the community to reduce the stress, sorry, to reduce the stigma that the community is having towards mental health problems. So there are a lot of things that happen. So this is the teaching part, and some outside the traditional hospital areas also acts as clinical supervisors. They get trained as supervisors in a particular therapeutic format. They work as clinical supervisors. They try to guide young psychotherapists who are coming up in the field to better handle their clients and to know more about what is actually happening to them. Okay, so this is the traditional and the non-traditional teaching that is available in an Indian scenario. So the next is consultancy. Okay, consultancy is at least in the last 4 or 5 years, I have been seeing there has been a lot of pace that has been gaining in the field of consultancy. So what a consultant does is based on requirement and based on the to share their expert knowledge. They go to different places just when they have been when there is a requirement that arises. For example, I work as a consultant clinical psychologist at Abundant Life as well. I'm doing my uh, full-time work as a assistant professor in Christu Jayanti College. So alongside formally, I am also acting as a consultant clinical psychologist at Abundant Life and in a couple of other institutes. So like this, when I start involving into consultancy program where I go whenever there is a requirement that arises to do an assessment or to get engaged into therapy, or even in certain places for teaching purposes or for research purposes, then these are called as consultancy. So many clinical psychologists have been branching out, have been going to various places, acting as consultant clinical psychologist in their specific area, trying to throw in a lot of light from the dimensions of clinical psychology. So even in a consultation also happens in form of administration also sometimes. So sometimes just for assessment purposes, for example, a specific company or an organization has planned to administer certain kind of test to or wants to scrutinize certain kind of clients, or to give a promotion or to take a higher step. So in those places also a consultant clinical psychologist would be involved to get a clearer picture. Okay, so also consultancy can happen in wide areas such as even forensic areas. There has been a lot of role that has been played by clinical psychologists where they go as consultants. They try to administer assessments and other things to get clearer picture. So in terms of administration, we go and work with organizations as consultant clinical psychologist. Even there are a lot of organizations where they require clinical psychologists to handle the uh, everyday stress that the person is experiencing, and the common mental health problems that is arising in an organizational setup, how to handle them. If a scenario arises, then the client would be referred, or the person would be referred for therapy and further assessments to get better picture about that particular person. So this is how a clinical psychologist can branch out into various fields as a consultant clinical psychologist. So if you look into these work areas, so if I'm going to broadly talk about what would be different work fields that we have, starting from private practice, hospital setups, school setups, colleges like academic colleges and hospital-based training colleges, and also many organizations um, in health related areas. So many places in as a health psychologist to provide more knowledge about health psychology, to improve the behavior of a particular person, and even in consumer related areas. So all these places a clinical psychologist has a major role to play. So we have a wide array of work areas that is available for us as a clinical psychologist. So we are not alone. So when we talk about mental health professionals, we do have some allied fields. Okay, so certain other areas that overlaps with the field of clinical psychology. Okay, so one of the biggest overlap we have is with the field of psychiatry. So where we stand out is in terms of administrating therapies and assessments. We gain a lot of expertise in that area. So the common areas that we both have is diagnosis and having an idea about assessments and therapy. So psychiatrists, all the psychiatrists do have an idea about what kind of assessments and how an assessment is done. So basic idea is there, even in terms of therapy, how a therapy is going to be effective apart from the medications that they prescribe. So everything they have an idea. So there is a lot of overlap with the psychiatrists we have. So the other field generally where there is a overlap is in terms of counseling psychologist. So I also heard in the beginning that you also got a very good understanding previously between who's a clinical psychologist and who's a counseling psychologist. So here, counseling psychologists are predominantly people who have completed post graduation in counseling psychology and who predominantly work with individuals who are facing day to day life related problems. So in terms of inability to solve a problem or marital related issues, so all these kind of problems that a person day-to-day act problems that comes up, so they work with those kind of individuals. Predominantly they work in or engage into what is called as a preventive work. Also they also branch out into vocational or career counseling, school counseling, personal counseling. So they also branch out into various fields like clinical psychology. So the major difference that comes up between counseling and a clinical psychologist is the clinical psychologist predominantly focuses on the mental illness or the disorders that are available. So, for example, if there is a client who's experiencing severe depression or anxiety, a clinical psychologist is a well trained or better trained person than a counseling psychologist at that particular point of scenario. At the same time, a child wants to know what particular course to choose after class 12, so where they have to go forward, how they have to choose. So in that field, more than a clinical psychologist, a career counselor or a counseling psychologist are well trained to go further. Okay, so apart from that, we also have various other aspects such as educational psychologist. So who gets involved predominantly into curriculum development, right, coming up with new teaching pedagogies. So the effect of right now we all are having a lot of online sessions that is going on. Primarily, I think none of us would have attended so many webinars in our life. So before COVID started, so it was a very distant term for most of us. But after that, it has become so close to us. In fact, all the education or learning processes that is happening in the last 9 months has been predominantly through online. So how these kind of online educations can have an impact on the child, so what kind of teaching pedagogy has to be adopted, all these things is predominantly discussed by an educational psychologist. So one particular area that generally uh, overlaps along with the clinical psychology field is um, the areas of learning disability. So how to develop a curriculum. So educational psychologists work in that area, how to develop a curriculum, how to apply the areas of like different teaching pedagogies for children with learning disability, whereas a clinical psychologist would be involved into diagnosing, doing a particular therapy, or getting involved into addressing the emotional issues or any other issues that happens because of specific learning disability. So that would be answered by a clinical psychologist. Again, another area is school psychology. So school psychologists, they are if most of you can recall, recently not recently, few years back, the CBSE's board syllabus had made it compulsory to have a school psychologist to handle day-to-day pressures of a child during the academic year. So a school psychologist again works in very similar to a counseling psychologist. So they work in whatever the everyday problems that a child faces, how to handle it, how to cope up with their stressful situations, how to enhance their well-being, so living life positively, enhancing the happiness. So these kind of areas, conducting training programs for the school students, trying to uh, reduce the stigma right at the early ages. These are the works done by a school psychologist. So another potential area why it is an allied field of clinical psychology is many school psychologists in fact give referral to a clinical psychologist for the assessment of attention deficit and hyperactivity disorder, specific learning disabilities, and also to understand about intellectual disability. If a child, why is the child not been performing well? Is there any other emotional issues that the child is going through? So to understand all these things, generally a school psychologist refers a child to a clinical psychologist. In terms of another allied field very closely working in this area of mental health itself is rehabilitation psychology. So here, yeah, rehabilitation psychologists, they work with individuals who are physically and cognitively disabled. Okay, so they work with them. So what are the kinds of various disabilities that they have, how to convert these disabilities into abilities, is what a rehabilitation psychologist basically getting involved into. So another area, clinical neuropsychology. So clinical neuropsychology, in fact, is an allied profession, but it is not something that is parallel to clinical psychology. It is a super specialization in the field of clinical psychology itself. So to become a clinical neuropsychologist, you need to complete your MPhil in clinical psychology, get further trainings in the field of neuropsychology to work as a clinical neuropsychologist. So they are predominantly involved in understanding many of my own colleagues who work in this field of clinical neuropsychology. I have seen they get involved into doing pre and post surgery assessments, trying to understand what are the various kinds of problems that the person is going through in terms of a post trauma, brain or head trauma. So what is happening to them? So what are the behavioral changes that has come through, and also getting involved into the clinical or neuropsychological rehabilitation process using varieties of training or exercises, brain related exercises that can rehabilitate a person to come back to his previous state of functioning. So in all these areas a clinical neuropsychologist predominantly works in. So like we saw of initially psychiatrist. So according to the um, Mental Health Care Act of 2017, four different areas are considered, four different fields of work are generally considered as, sorry, three different fields according to the law are three different fields. So who will be considered as a mental health professional in India? So the first person who would be considered is a psychiatrist. So second is persons who fall under the section 55. So where there are three different professions that are mentioned there. So one is a clinical psychologist with a clear-cut definition or understanding of who a clinical psychologist is, then a psychiatric social worker, and a psychiatric nurse. And the third group in that list of mental health professionals is person who have specialization or masters in any of the Ayush related branches. Okay, so they can be called as a mental health professional in India to deal with any kind of mental illness and mental disorders. So only these are the people who are legally eligible to practice in India. So in terms of psychiatric social workers, so they are the people who enhance the connect between the society and the hospital. So they are the ones who go out on the field, work in the field, try to create an impact and try to create uh, array of knowledge where they try to make the person understand what is actually a problem in what is mental health, how mental health can be enhanced, what are the ways that they have to follow. So they go to the community, to the actual setting, and then they work predominantly many psychiatric social workers work in the area of family and marital related functionings also. So apart from that, we have psychiatric nurses who also get trained in various diagnosis, trying to understand and they work along with the psychiatrist, clinical psychologist, and the psychiatric social worker in a typical mental health setup. Okay, so coming into what are the skills that you would require as a to require to become a good clinical psychologist. Okay, so there are a lot of skills. I have tried to reduce it to few that I can immediately think about. So first of all, we need to understand in India, if you want to become a clinical psychologist, already that is a long and hard pathway. Okay, after your undergraduation in psychology, you have to complete your post graduation in psychology. After you complete your post graduation in psychology, which already has taken up 5 years of your life, you would have to write an entrance exam. Once you clear that entrance exam, then you will be eligible to go ahead with your MPhil um, clinical psychology uh, program, which is again another 2 year program. So already you would have spent around 7 to 8 years to get the title of clinical psychologist. So once you become a clinical psychologist, to become a very successful and a competent clinical competency is a very important area that we need to look into. So if you want to call yourself a competent clinical psychologist, you should have that required knowledge, skill, and aptitude. So once you gain that, to gain that, it takes a long time. So that is why this field of clinical psychology has been ever growing in India. Okay, so it requires a lot of hard work even during your MPhil days. I'm not sure. I saw some of my friends and seniors joining this meeting some time back. So if you ask them, they can easily share their experience of how much of hard work and high level of motivation that they needed to have in order to complete the MPhil program itself, because it's a long and strenuous program. It's a 2 years continuous program where you'll be having a lot of challenges that would be thrown. You'll be going for regular hospital duty, you'll be completing your work there, you'll be coming back, completing your day-to-day reports, activities, make sure you are getting prepared for the next day classes alongside it. So there will be a lot of work that would come along in the clinical psychology program. So it requires a lot of hard work from your side, and you need to have high levels of motivation in order to pursue or because I have seen many people initially after 2 or 3 months of joining a program, they tend to drop out because they do not have enough motivation to sustain till the end. So you need to have a lot of patience, hard work, and motivation. Also, dedication to help a client is very important. You need to have the patience to learn whatever is coming towards your side, and it's not as easy as we see in a day-to-day book. Okay, so okay, cognitive behavior therapy is very effective for depression. Okay, I do 10 sessions of cognitive behavior therapy, patient's depression is gone. No, it's not going to happen that way. It's just going to be different from one client to another client. So you need to be very patient. In order to become successful, you need to have a lot of patience, you need to wait, you need to see what is happening. Also, it becomes very important for you to gain empathy. So empathy is a very, very, very important area that as in the field of psychology itself, empathy plays a major role. And if once you want to come into the field of clinical psychology, the need and the importance of empathy gains even more. Okay, so problem solving skills, you need to have a lot of problem solving skills. You need to have creative ways of coming out or thinking about a solution for a particular problem that has been presented. You need to have a lot of good amount of listening and communication skills. You need to keep listening to the clients, try to understand. You need to put forward your thoughts and processes in an appropriate manner. You need to have good set of scientific techniques, because this training model that we follow in India predominantly trains you in academic field, in the training, in the clinical field, as well as in the research field. So you need to have good amount of scientific techniques to grasp what is happening. Okay, also have a strong interest in healthcare and science industry, because healthcare industry, you require a lot of you need to wait for the client to come up and cure from the problem. It's not going to happen very quick. So you should have a strong interest if you want to come into the field of clinical psychology. Also, we need to be able to differentiate between what is called as normal and deviant functioning. Okay, I would not want to call it as abnormal. So what is when we are saying deviant, it is just not normal, or it doesn't follow the same track. So we want to understand both, then we can excel in this field. So that is when we'll be able to draw a comparison. Okay, so this is what I expect, this is what is happening, so this is the problem, so this deviation has happened, let me bring the client back into this particular field. Okay, through thorough knowledge and skills in various assessments and therapy is something that you require. So many of the MPhil clinical psychology training programs make sure that you are skilled and trained in various types of assessments and therapy through a lot of case therapy submission, psychotherapy submissions, and assessment submissions. That is a part of the MPhil training program. Also, along with empathy, another thing that would be required is for you during therapy sessions, even during clinical interviews, inspiring trust and confidence in people. That is when they'll start opening up, they'll start sharing what are the problems that is going on, they'll be able to give you more ideas about. So when we have a detailed idea, when we know what is actually happening with the client, then we can come up with better solutions. So you must be able to inspire trust and confidence, and also you must be able to explain. This is a very important thing, because not all the clients, especially in an Indian scenario, if you see, not all the clients have an expert level of knowledge or deep knowledge in the field of mental health related problems. So, as a clinical psychologist, you should know how to tone it down to different categories of people. So, when a person from a very poor economic status coming to you, so you must be able to go down to their level, make them understand what is this problem, how does this problem look like, what are the key points that they have to look for so that they can come out of this problem very quickly. Okay, so we need to make sure that we are looking into these things and answering these things. Also, I told you, when we were discussing about assessments, we need to know how to write reports. We need to know how we are going to write reports. So during your training program, again, you'll be very clearly trained in how to write a clear and concise report in the areas of assessment that you are getting trained in. Okay, so let me I'm yeah, I do have some more time, so let me just quickly get into how to become a clinical psychologist in India, because this is a major question that most of us, at least as a clinical psychologist here, who where I was getting um, guided, I was shown the enough pathway from my teachers to how to become a clinical psychologist. So I thought today I'll take it up and help you to know how to become a clinical psychologist in India. So first of all, we need to know there are different institutes. Okay, so what we are looking here to for an MPhil in clinical psychology program is an institute that is recognized by Rehabilitation Council of India, which has come up with clear set of norms, rules, regulations according to the Rehabilitation Act. So based on that act, this body was formed, and this body is the regulating body for the various MPhil clinical psychology training programs that happens in India. So there are around 38 training institutes which are available across India, which are eligible for providing an MPhil in clinical psychology. Okay, so a strict scrutiny goes on every year. So this list keeps on changing every year. So probably whatever I'm going to tell right now might not be really valid for the next year, because probably RCA would have had another set of assessment or surprise visit where they would try to evaluate the institute's performance and say whether they can continue providing MPhil in clinical psychology program. Because I've heard many institutes not conducting a training program for 1 year in between, again restarting it after fulfilling the necessary criteria put forward by the uh, Rehabilitation Council of India. Okay, so and moreover, there is a specific selection process. Okay, I'll be talking about that specific selection process, because many of them do not understand how what it takes to become a clinical psychologist. Okay, there is a specific selection process that goes through if you want to become a clinical psychologist. So yes, I'll just I'll just briefly tell you to walk you through a India map where all are the different institutes, how many institutes are available in each places. I'll just take you through. Okay. So again, as I told you before, this data that whatever I got is predominantly from the RCA website. Okay, Rehab .nic.in. So you can go there and gov.in, sorry. You can go there and you can visit it, and you can always check what are the currently recognized list of colleges or institutes that is eligible to provide MPhil in clinical psychology. Okay, so just for more detail, please go visit the website. Okay, so let's look into the India map. So when you're going to look into the India map, so we can see, starting from South India, we have three institutes in Tamil Nadu. Okay, we have Sri Ramachandra Medical Institute and Research Center. Then we have SRM University. Then we have NIPMed. So these are the, and also four. I'm so sorry, four. Institute of Mental Health is also another institute which is a part of MPhil clinical psychology training program currently. So there are four different institutes that provides MPhil in clinical psychology. Again, the number of seats are not going to be very high. It depends upon various factors, number of people who are there, how many different types of assistant professors, associate professors who are available. Depending upon that, there is going to be a specific set of seats that are available. Okay, so the maximum number of seats is provided by NIMHANS, where I think there are 26 seats currently. Okay, so that is the maximum that is available in India. Rest of the places vary somewhere between 8, 4, 8, 12, 16 or 20. That's the count generally that happens. The maximum is provided by NIMHANS in Bengaluru. Okay, in Kerala, there are a couple of institutes. Okay, there is one institute in Calicut and one institute in Kochi. Okay, Amrita Institute of Medical Sciences. They also have restarted their MPhil clinical psychology program, and also there is I'm not getting the other institute's name. Institute of Mental Health. IMHANS in Calicut, that is also providing MPhil in clinical psychology. So if you're coming up to Karnataka, in Karnataka, there are four institutes, I'm sorry, there are four institutes right now. So NIMHANS is the one every one of us are very familiar with. Apart from NIMHANS, we have in Mysore JSS Medical College, and then we have Manipal Academy of Higher Education. They also have in their Kasturiba Medical College, there they have a MPhil in clinical psychology program, and there is DIMHANS, that is Dharwad Institute of Mental Health and Neuroscience. So in Dharwad, so they also have an MPhil in clinical psychology program. So there are four institutes in Karnataka providing MPhil. There is no institute in Andhra as of now, but in Telangana, there is one Swikar. Swikar is again another old institute that has been there for a very long time. And in Maharashtra, predominantly in Mumbai, we have one institute as of now. Amity is having one branch in Mumbai, so that is one institute. There is another institute that is about to start, but still it has not been updated in the RCA website. In Gujarat, we have Gujarat Forensic University. In Rajasthan, I can say in Rajasthan, Madhya Pradesh. Yeah, so these are some places. So in Rajasthan, Madhya Pradesh, and Maharashtra. Yeah, where else? Yeah, correct. Uttar Pradesh. A couple of institutes in Uttar Pradesh. All are done by all are Amity. Okay, Amity Institute has different branches in these places, so they also run MPhil clinical psychology program. So coming here, Jharkhand has a MPhil clinical psychology program. That is, two programs are running in CIP, Central Institute of Psychiatry, Ranchi, and also there is one in Rinpas. Okay, so these two institutes are running MPhil clinical psychology program. Then in Odisha, there is a training institute that has started. Then we have Rajasthan, Jaipur, we have covered. New Delhi, there is IBHAS, again, another very famous institute. In Uttar Pradesh alone, there are 6 different institutes, along with 2 institutes of Amity. There is King George Hospital and other places. And also there is, in Agra, there is one government hospital. So they are also providing MPhil in clinical psychology. Then in Haryana recently, they have started, last year they had started an MPhil clinical psychology program. Also in Kashmir, there is one government hospital that has recently started the MPhil in clinical psychology program. Then coming to West Bengal, there are 2 institutes. Again, yeah, Amity also has a branch in West Bengal. So there are, I think, 2 or yeah, two institutes, three institutes, or I think two institutes in West Bengal that provides MPhil in clinical psychology. Then we have um, three institutes in the Northeast, sisters. So one is in Assam. So that is where I had completed my MPhil in clinical psychology. It's a central government hospital called as Lokapriya Gopinath Bodoloi Regional Institute of Mental Health in Tezpur. It's not under the Tezpur University, it's under the Guwahati University. So LGBRIMH, that is the short form. So that is one institute. And Manipur has, in Imphal, there is one training institute. And also in Tripura, recently, I had started a MPhil in clinical psychology program. So these are the three Northeast states where MPhil clinical psychology program is happening. So across India, if you see sparring a few states, almost all the different states are having one or the other clinical psychology program, training program that is happening altogether. If I'm not wrong, there are around 250 seats that are available as of now currently. This number can increase and decrease every year, so it's just an average number that I'm telling you. So some of these institutes do provide you a stipend. Okay, the stipend can vary across different places. There are many institutes who do not provide any stipend as well. So, for example, Nimans, CIP Ranchi, LGBRIMH, IBHAS, all these institutes pays a good amount of stipend. So, stipend again varies between somewhere between in Agra, where they pay 2,500 to Nimans and LGB, where they pay up around 25,000 as stipend. So stipend amount also keeps changing from one place to another place. Certain places, mostly private institutes, they do not provide any kind of stipend for the work that is done. One private institute that is currently paying or providing stipend is JSS Institute in Mysuru. So they are providing stipend. So these are the various programs and various places where you can find. So if you feel you want to venture into clinical psychology, so just like what I did, traveling from Tamil Nadu to uh, Assam and learning the field of clinical psychology, learning a new language, where many of my friends also were from Kerala, Tamil Nadu, Andhra, different places where they came to our institute and learn. So boundaries are not to be there. So please look into all these institutes, various options that are available. So make sure that you are exploring into these areas and try to um, learn more about the field of clinical psychology. So I told you I'll be talking about the admission process. So this is an admission process that is mandated by RCI, Rehabilitation Council of India. Okay, so the admission procedure is that a selection committee would be first of all instituted, where the head of the head department of clinical psychology would be playing a major part along with certain other members from the university. So they'll be playing a major role in the admission process on the basis of entrance examination that consists of written test and interviews. Okay, so you'll be writing a written test and also an interview will be happening. And again, this particular perspective that has been given by RCA has been very flexible. Okay, it is not a rigid one that everyone should do 100 questions in this much of time, and only these things should be asked in interview. No, it's kept flexible. If you see across different institutes, there is no singular syllabus that is available. Okay, so it's a very broad array of syllabus covering all your topics in post graduation in clinical psychology or psychology program. So that you need to be completely aware of. Okay, so the admission procedure is mostly flexible. It keeps changing from one place to another place. So predominantly it changes based on the type of exams. More predominantly every place, it's going to be one word questions, subjective type questions. In certain places, subjective type questions are also available. And also the process, interview process, and the kinds of things that happens in an interview also keeps changing. So basic entry requirement according to RCI is that minimum educational requirement for admission is there will be a 2-year MA or MSc psychology degree, okay, in psychology from a recognized university by UGC with a minimum of 55% of mark aggregate. Okay, 55% mark aggregate, and there is a 5% relaxation for students coming from SC/ST category. Okay, this is as per the government of India. Whatever norms has been created, they should have completed MA or MSc with that particular degree. Okay, so once you get through this eligibility criteria, you'll be putting through an application, you'll be paying the required application fee. Then after a point, after your application gets scrutinized, you'll be asked to come for a written exam. Okay, written exams, except in Amans, everything happens in the local institute. Also, Amity is also recently conducting online assessments. So apart from that, predominantly it is a you go to that particular place in you'll be having an interview. You'll be having your entrance exam in their campus itself. Okay, so various institutes, they follow institutional criteria for written examination. So as I told you, almost out of the 38 institutes that I was telling, until now, what I've heard is 37 institutes follow only objective type questions. One institute follows both objective, also has half the amount of subjective type questions. Okay, so a little, I think 20 or 25 marks of the entire uh, mark is given for subjective type questions as well. So the number of questions keeps changing. So the mark provided for each question keeps changing. The types of questions absolutely keeps changing. So for example, certain institutes, okay, does not focus only on psychology. They also go out of psychology. They ask questions from reasoning, aptitude, to just check how well you are in solving a problem that has been presented. So it can keep changing. Okay, so there is no fixed syllabus or standard things that I can tell you that this is how it is going to happen. Next, once you clear the written exam, generally a merit list will be put forward. Okay, so generally the interview happens within a couple of days of the written exams. So a merit list will be put. Based on the merit list, you'll be called for an interview process. Again, this interview process can be different from one organization to another. So I have seen some of my students going to PGA BAMS in Odisha, where they were asked whether you have previous work experiences, whereas other institutes where they had attended their interviews, they were not asked such kind of questions. So it depends upon one place to another place. Okay, so some institutes, they just go based on the merit list. So if you have got a specific rank in that merit list, then that means interview process will be just to check the eligible documents, whether you have everything. If you do not have the document, then the seat might go to the next candidate in the merit list. Apart from that, you will be predominantly you are eligible. But there are certain other institutes where they take or give considerable amount of marks to this interview also. So it can change again type of questions that has been asked. So many of my students who attended recently, they told about institutes, especially institutes such as CIP, IBHA. So all these places, they have a process where they expect you to answer or talk about certain kind of test processes also. So how to administer a test, how would you score it, what would be the interpretation, all these things must be thorough from the client side. These so there are other institutes who call for the interview based on this eligible candidate list. Whoever clears the interview gets through. Okay, so it can be changing from one place to another place. So once a person completes MPhil in clinical psychology, okay, then you can be called as an expert in conceptualizing and diagnosing mental health problems, various psychological assessments in its administration, clinical interpretation. Also, you'll be trained in various psychotherapies. Okay, you'll be given enough skills to practice and learn further in the field of psychotherapy. So with this, I would like to uh, stop my conclude my talk, and I can take any questions that you have across the domains to help you understand more about clinical psychology. So for further details, if you want to get more ideas or contact me, the contact details are given here. So you can make a note of this and you can call me at any time. Thank you all. So the session is handed over back to the moderator. If they have any questions, I am ready to take up.
Yes, sir. So before we go into the question answer session, So during the session itself, we have got a lot of positive responses saying this is an amazing session and so on. And even I myself was literally, so even if I'm going to be at ground zero level and I'm just saying, okay, let me just think if I want to go into clinical psychology, I now have the entire picture as to how to become a clinical psychologist. And that is really amazing. So first of all, thank you so much for giving us in detail such an amazing presentation and in detail explanation for that.
Thank you so much. Thank you
And
for providing the opportunity.
for the participants, just so this was more of a 1 hour and 15 minute session, and we will definitely continue with the question and answers going on. But if you want to know more about clinical psychology and clinical psychology, things related to clinical psychology, Abundant Life is providing you with internships in clinical psychology, and our own Vikrant sir is also teaching some sessions in that. So visit our social media pages to actually get registered yourself for that. And the next session is starting on 19th of December. Okay, so people, whoever has questions, please post them in the chat box. So I will take them one by one. You could post it publicly, or you could even send it personally. So both of them will be agreed. Okay, so let us start. First question is, can a clinical psychologist be also a special educator?
Yes, but again, if you're going to look into the kind of specialization that you require to act as a special educator, the skill sets and the kind of knowledge and degree that you need to gain is very different from a clinical psychology. So there's a specialized B.Ed in special education program, okay, which you would have to undergo, again, which is also RCA recognized. So once you complete that, then you can call yourself as a special educator.
Okay.
So I think someone has put a question to me. So the question had come long time back. So
Okay.
can we take up that question?
Yes, sir. Sure.
Yeah. So the question is, can we become a clinical psychologist if we did a UG in a different program, suppose BCom and MA in psychology? If so, what else we need to study, and will we be eligible for the exam, whichever you said we have to write? Yes, Anusha, you will be eligible to take up the exam if you have a master's in psychology. If you remember, in the end of the fag end of the presentation, I was telling about the eligibility criteria to apply for MPhil in clinical psychology programs. There are many people who have branched out from different fields and entered into psychology and got into clinical psychology as well. Okay, so it is possible. So you need to focus more on to. So if I'm going to talk about how to prepare for an MPhil examination, that itself is a separate session. We require a lot of time. So basically you need to get yourself prepared with the entire post-graduation syllabus, because the questions are going to be wide and application oriented. So you need to develop such wide round knowledge in order to answer to those questions. Yeah. Yes.
Okay, so we have a question saying, so first of all, they have a feedback. So they said, thank you so much, sir. This was an amazing session. I have almost all my questions answered. Just one follow-up question where you mentioned that all institutes in MP for MPhil programs, are they under Amity University?
Not everything, not everything. So I two institutes are part of no, you're talking about MP, Madhya Pradesh.
Yes.
Madhya Pradesh has only one institute, and it is Amity. But I'm not sure if there is any other new institute that has come up in the recent days. Probably you can once again check in the RCA website. You'll be getting all the details in a PDF format. But as of now, there is one institute which I'm aware of, which is from Amity.
Okay, so the next question says, so how will I know that if I can go for clinical psychology as a career stream, or I should go for psychiatry? How will I know that?
Okay. Psychiatry is something which for which we are not eligible as of now. So if you are in class 12 right now, and if you are in a biology background, probably then you can complete your MBBS. Okay. Once you complete your MBBS, you have to go and do your MD or DNB in psychiatry, for which you will be eligible to practice as a psychiatrist. if you are a student who has already ventured into the field of psychology in your undergraduation, so you can get into the field of clinical psychology only. Okay, so you'll be eligible only to become a clinical psychologist.
Thank you, sir. So there's another feedback that says, thank you so much, sir, for excellent session. It was very informative and gave us clear picture of the field, clarified all the doubts and vague ideas about clinical psychology and the role of clinical psychologists. And we have few more feedbacks. Okay. So there's one person who has asked, can you please explain more about clinical neuropsychology programs?
Okay, yeah. So, as I told, clinical neuropsychology is a super specialty program. So, already clinical psychology is a specialized program or a specialty program. So, the field of clinical neuropsychology becomes a super specialty program. So, currently in NIMHANS, there is a 1 year training program or post your MPhil. Okay, so you will be eligible to apply for that 1 year training program only after you complete your MPhil in clinical psychology. So, once you complete that 1 year of training program, then you can call yourself as a clinical neuropsychologist. So that is the only pathway as of now. So apart from that, during your MPhil days, as I had told you in assessments, you will be trained in different neuropsychological assessment. You will have idea, but if you want to gain more idea about how cognitive neuroscience, for example, how to take an EEG, how to read an MRI scan, and how to utilize EEG as a rehabilitation program or EEG ERP related aspects. So for all those kind of functionings, I think you would have to get a super specialty training, because that does not come as a part of all the MPhil clinical psychology programs. So for gaining more ideas, you would have to do such kind of programs, or also you can plan and do programs from outside India. So after your MPhil in clinical psychology, you can do a 1 year or 2 years in neuropsychology program from abroad countries. Then you can come back and you call yourself as a clinical neuropsychologist.
Okay, so there's one person who says this is a little off subject, but
Yeah.
I want to know if I do a master's degree in counseling from an open university like IGNU,
Mhm.
am I eligible to do a professional counseling?
Okay, it's about counseling. To talk about counseling again, counseling is a highly skill based program. So if you look at most of the counseling psychology programs, I've seen a lot of counseling psychology programs that happens in India, even in our college. So we have an MSc in psychological counseling program. So that particular program gives the students a lot of hands-on experience, a lot of field works, a lot of orientations, so supervisions that happens as a part of the counseling programs, trying to help students to understand. So what I have seen in many open universities is you do get a lot of chance of internships, but the supervised practicums or supervised trainings and getting in touch with the teachers regularly, that very rarely happens. So if you want to practice in the area of counseling also, you would have to get yourself trained, do equip yourself with the skill that is required to become a counseling psychologist. You need to enhance those skills. You would have enough knowledge. So I told you about competency. So if you look into the ethical aspects, also competency plays a very, very high role. So APA ethics, if you go through, one of the important points they focus on is how to improve the competency of a particular person. Okay, so the competency is a three-part areas. Okay, so it involves knowledge. Okay, which you will be getting in any of the programs, any of the educational programs that you're going, regardless of whether it is going to be open or regular courses. Okay, also in many websites and other places, you can gain n number of knowledge, but knowledge alone doesn't make competent. So you should have the skill. The skill comes through a lot of practice. Okay, a lot of training, discussions, supervisions. The skill is going to get developed, and the last part of attitude also get tuned during a regular session, so which generally lacks. So I would press you to take a, a- take a training program under someone, under a counseling psychologist for a period of 1 year or 2 year. Get to know or develop your skills and change your attitude. get supervised under a particular person for a long period of time, then you can go out and start practicing in the field of counseling psychology. That would be my suggestion.
Thank you, sir. So the next question says, so I am in the second year of my MSc Applied Psychology through
Mhm.
distance education.
Okay.
Am I eligible to apply for MPhil Clinical Psychology after my post-graduation is completed?
In terms of eligibility, yes, because eligibility is um, a very hazy thing. It's not very clearly mentioned who's eligible. But certain institutes interpret it in their own way and say this particular program is open only for students from regular stream. So you can check the eligibility criteria of each of those institutes, and in fact, you can take it up. You will be eligible in certain institutes. You would have to again the process is going to be same. The written test, all those processes going to be the same for you.
Thank you, sir. So, okay, there's another question. It says, sir, can you please explain more about educational psychology?
Okay. Education psychology. Okay, so again, it's a very a field that has not been focused on most of the psychology departments, unfortunately. Many of the education departments in India, many universities and education departments in the universities, they focus a lot on educational psychology. So, as I told you, it tries to understand how the learning process happens. What are the different ways in which we can enhance the learning capacity of a person? How can we teach certain things in a more effective manner? So they try to understand and what are the common problems. For example, exam related anxieties, how to reduce it, or how to creatively and effectively come up with an exam mechanism that can test the child or the person from different perspectives. Okay, so that is the predominant work areas of educational psychologist. So if you want to become an educational psychologist, you would have to do a PhD in education psychology. So there are psychology departments with specialized educationalists. For example, in Mysore University, there is a NCRT campus. In that NCRT campus, there is a psychology PhD that is happening. So that particular program, I have one of my colleague who had completed his PhD from there. So he specializes in the field of education psychology, where he works with gifted children. So he works in the area of gifted children, how to handle them, how to teach them, what are the different teaching pedagogy, how to design a curriculum that would fit for more of a gifted children. So again, other extremists who are a slow learner, how to design a curriculum for slow learners, how to handle them in the classrooms, what kind of remedial sessions or classes to happen. These kind of things would be studied in the process of educational psychology. Yeah.
Thank you, sir. So, another question is, so if I am doing my undergraduation from a different country and doing my, can I continue my master's in India? And if I
Okay.
do my master's there, will I be eligible for MPhil in India?
Okay. Okay. Yeah. That's a very good question. So there is something called as an equivalency certificate. Okay. So this is a question which I can answer with a lot of ease and confidence, because I had one of my friends who had completed her post graduation in US. So she completed her post graduation in US. She came back to India. She wanted to pursue MPhil in clinical psychology. So there is something called as an equivalency certificate that we need to submit to the specific organization. So if it is going to be NAMANS, then NAMANS would expect your equivalency certificate. Equivalency certificate is nothing that it says or it compares the syllabus that has been provided by that foreign organization and the institutes in India. So it tries to draw a comparison and says whether this particular post graduation program which has been done by this specific person, whether it is equivalent to the MSc program or MA program that happens in India. So they will give you a certificate from UGC. You need to get the certificate. So once you have got that, then you will be eligible to apply for MPhil clinical psychology. Coming to UG to PG, predominantly there is um, no restriction, because it's left up to the discretion of the college. So college says that, for example, most of the psychology programs in India, they require you to have an honors degree in psychology, or at least psychology as a major paper in your degree. So if you have that, then you will be eligible. So that would be the for your first question.
Okay, thank you so much, sir. So there are so many people who are so comfortable, so contented with this session, and everybody is thanking you. So some of those thank yous
Thank you.
have come to me privately, so I'm just sharing it with you.
Thank you.
So there is this interesting question. So can you please explain about the licensing for a clinical psychologist?
Okay. So the licensing process starts off when you get into MPhil in clinical psychology. Okay, so as I told you, across the period of 2 years in MPhil in clinical psychology, you would be having. Let me stop my screen share here. So across the 2 years of MPhil in clinical psychology program, so you'll be having a lot of case submissions. Okay, so you'll be in the first year, the predominant focus is given on diagnosing a client and coming up with a complete case history. So there is a required number of minimum required number of clients cases that you need to submit. Then in the same year you would have to submit around 100 or 50 to 100 psychological assessment reports, okay, consisting of intelligence, neuropsychology, personality, and other, and also a diagnostic evaluation. So like this it has in the first year, and then the second year along with your research you'd be expected to complete a psychotherapy case submissions. So based on this, this becomes your first level of qualification. So once you complete and you get the degree of MPhil in clinical psychology from your college, you will be getting a letter, which you would that along with that letter, there is a form that you would have to go on the RCI website. Okay, there is RCI registration. .gov.in. So you go to that website, you uh, take up all the details that has been put up there, pay the required amount, and you get the licensing. This license is valid for 5 years. A license, a single license that you're going to get is valid only for 5 years. After the fifth year, you should renew it by completing what is called as continuous rehabilitation education programs. So there is 100 points that a clinical psychologist has to collect within the period of 5 years. It can come through attending workshops, seminars, webinars, conferences, presenting papers, publishing papers, being a resource person, conducting conferences. It can come. It just shows how much of knowledge you have gained in that particular field. Okay, so the amount of knowledge that you have gained, or the you have to prove to the council that you have been trying to maintain the competency by keeping yourself aware of the recent trends that is happening in clinical psychology. So once you do that, that means you will be eligible to um, renew your license for the next 5 year period. The same rule apply for the next 5 years. Again, complete 100 points, you'll be eligible for the next 5 years. Yeah.
Wow, thank you so much for that, sir. Okay, so the next question says, can you please explain about the application of clinical psychology in criminal field?
Okay, criminal field. So I told you. So in fact, one of the first criminal psychologist or forensic psychologist that was there was Professor Vaya. So she is a trained clinical psychologist. Okay, so she got an opportunity to work and in the field of forensic. So she had gone. She has shared a lot of her knowledges across various platforms. So she was the one who was also responsible for starting the like was one of the important persons in the Gujarat Forensic University, and started the MPhil in clinical psychology and the forensic psychology program, MPhil forensic psychology and MSc forensic psychology. So the role of clinical psychologist here predominantly comes or starts with the area of assessment, diagnosis. Okay, these are the predominant things. So what kind of problems or what kind of issues that the person has happened, how to diagnose it. That is where we try to involve or get uh, play a major role in the field of criminal psychology.
Thank you so much, sir. So,
Thank
okay.
you.
So another question that says, when will I be eligible to be called as a therapist?
Okay, that is a very tricky question to answer. Generally, again, we need to clearly draw a line between who's a therapist and who's a counselor. Okay, so that itself is a very major task. So because this this question, when I started asking myself and when I started do a lot of reading, I got a kind of a picture what is meant by therapy and what is meant by counseling. So therapy is somewhere where we deal with in-depth problems. We try to go a lot more deeper than in a counseling session. We try to see what is the exact problem, that is what is the exact source of the problem. We try to correct it right from there. And predominantly therapy is a term that is used in hospital setups in terms of people with mental disorders. So if you're going to go by that definition or that explanation of what is a therapy, so then only a person with a RCI license would be eligible to practice therapy in India. Okay, because when we use the term therapy or psychotherapy, that means you are directly involving with clients or individuals who are having mental health disorders. So this in accordance to the Mental Health Care Act of 2017, which very clearly states that only the three different sets of or six different sets of people would be eligible to practice as mental health professionals in India. Yeah.
Thank you, sir. So thank you so much for those questions. So is there any other questions? So, okay. So there's a question on YouTube. So someone who's watching on YouTube has a question that says, so I am a student of MSc Psychology from IGNU. So can I apply for MPhil? I think it was answered, but yes, a student of CFT.
Yeah, that's what. So it depends. It depends upon the institute where you are applying. So you would be eligible depending upon the basic eligibility criteria that I had shared before. You will be having the enough eligibility to apply.
So, but the CFT part, so that is like counseling and family therapy. So they're doing MSc in counseling and family therapy. So will they be eligible to apply for clinical psychology MPhil?
No. What would be their final degree title that they'll be getting?
So it will be MSc in counseling and family therapy.
Counseling and family therapy. The word psychology is missing there, because if you look into the eligibility criteria as I had shown you, the term counseling psychology, if you have a degree called as MSc counseling psychology, then you will be eligible. Okay, even MSc counseling psychology student, I have seen many people have come up and put in extra efforts to clear the MPhil entrance and got into MPhil programs in clinical psychology. But this particular terminology I'm not very familiar with, and I'm not sure. Probably certain institutes might again ask you to submit an equivalency certificate. So this is a common tradition. So when you have studied enough amount of subject, okay, if you submit your syllabus, your marks card, okay, so marks card would predominantly say what are the different courses, and they will try to compare it with another equivalent program such as MSc Psychology. And if the kind of credits and courses that you're studying is equal to them, then they will be providing an equivalency certificate. With that, you will be eligible. I'm just not very sure about that, because this terminology of counseling and family therapy without psychology is very difficult. In the scrutiny level, it might not get selected because the term psychology is missing.
Okay. Thank you so much for that, sir. So this is a personal question. So like
from you itself.
Yeah, from myself. Yes. So if I have an equivalent degree, I don't have, let us say I don't have MA or MSc, but I have a postgraduate diploma, will I be eligible for MPhil?
No. 2 years of psychology program is compulsory.
Okay, but if I have more than one postgraduate diploma, will it be counted?
You should be having what is called as a post graduation in psychology. PG psychology should be there. Postgraduate diplomas are not considered here.
Okay, so that's all the questions that I have, and indeed there are so many thank yous and so many amazing sessions. We want more sessions with you.
We'll be happy.
Yeah, thank you so much, sir. Loved your session.
Thank you.
And a lot of people have like personally thanked, and they said it's a wonderful insight. And there are people who said it's so good, I'm going to cry. So yeah. So this is indeed an amazing session. And yes, people, so if you want to know more about clinical psychology, do enroll for the internships. Visit our social media pages for the registration links or contact us personally. So we would allow you to get registered for the clinical psychology internships, where we would get more in-depth knowledge about the clinical psychology and the various aspects of clinical psychology and things that is surrounding clinical psychology. It's like diving in and standing out. We would be getting all those lights, all those aspects of psychology. So do visit that. And thank you so much, sir. Thank you so much for giving us such a wonderful session that we didn't even realize it's almost going to be 2 hours. So we were literally glued to our seats because there's so much of information, so much of knowledge sharing, but it was not overloading. So it was the right amount of things. But I am personally overwhelmed with this experience. I hope the audience also has this. So thank you so much, sir. And thank you so much, people who joined in, who contributed by way of questions, by way of suggestions and feedbacks, and people who will be watching this session on YouTube. Thank you so much. So I take this opportunity to thank you personally as a representative from Abundant Life.
Yeah, I would also like to thank everyone for being here, asking such beautiful questions. I hope I would see all of you sitting here today to become a clinical psychologist. There is a lot of need to have a lot of professionals in the field of clinical psychology. So I'm sure this session would have given you some insight about what you need to do next. Start preparing early. I'm sure you all, I would love to see most of you in the field of clinical psychology in a short. Thank you.
Okay, so I have also shared the recorded YouTube version. So the YouTube will be ready in about 2 hours. So post which you will be able to watch this session, and do watch it. Do subscribe to us for such wonderful and amazing videos, such wonderful and amazing sessions in the future. And let us know if you have any feedback or suggestions also there. Thank you.